Hi, everyone. My name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And today I'm talking to you about food allergies, food sensitivities, and how do you know if you have them. So these can cause all sorts of health problems. Everything from starting from the head down, headaches, brain fog, lack of focus and concentration, fatigue, throat, sore throats, canker sores, sinus congestion, ear infections, digestive issues, constipation, diarrhea, IBS. Food sensitivities and allergies can also cause skin reactions, itchiness, eczema, psoriasis, acne. I mean, there are just almost any health issue you could think of, food sensitivities or food allergies can be involved. Even in the heart, heart palpitations, fast heartbeat, lung congestion, asthma. One of the most common causes for asthma is food allergies, bronchitis, and overall body aches and pains, inflammation. Rheumatoid arthritis is linked to food reactions and sensitivities, food allergies. Overall fatigue, sluggishness, even hyperactivity related to food sensitivities. And weight gain is a huge issue with food sensitivities. Inability to lose weight. I mean, I had a patient recently. She was, 35 years old. And she came in for a host of health issues, but one was that she was unable to lose weight. And she went on a number of different diets, even a ketogenic diet, which, as you know, is really popular right now. So she did that for an entire month and lost like 2 or 3 pounds at the most in a month's time. And once we figured out, put her on the free diet, which I'll talk to you about in a little while, and also provide you a free copy of phase 1 of the free diet. We'll provide a link for you. But anyway, she went on that, and in the first 2 weeks, dropped 10 pounds. So food or weight gain, inability to lose weight, it's not about the calories per se, but food sensitivities are a huge part of inability to lose weight. And there are different types of food. We'll talk about 2 basic types of food allergies. So one is a true food allergy, acute, immediate reaction. And this is something like, for instance, if a child eats peanuts they're allergic to, they can get swelling, difficulty breathing, anaphylactic shock, or even cause death. That's a true food allergy. And there are different levels of it, from mild to severe. Skin reactions, hives, and breathing issues are the most common, but also vomiting and diarrhea, digestive issues as well. But those are true food allergies. And how do you know if you have them? Well, most people know because they have an immediate reaction. That's very easy to see. And also there are skin tests for that, where they do scratch testing with a number of different foods or environmental allergies. And secondly, blood tests. You can do a panel of a number of different foods to see if you have a true allergy. Much more common than that is food sensitivities. Those are very common, and probably almost every patient that comes into the natural medicine clinic, I've been practicing over 30 years now, and I would say almost every person that comes in with health issues has food sensitivities. And these are delayed reactions where you don't necessarily notice something right away. It could take an hour or two, even the next day, or two or 3 days later. So they call them delayed sensitivities. And this is, for instance, gluten is a common one where if someone eats gluten, they're not necessarily going to have a very quick reaction necessarily, but within an hour or two or the next day or day after, that's a food sensitivity, not necessarily a true allergy. So how do you know if you have sensitivities? So this is two ways for this also. There are food sensitivity tests you can do, and there are a number of different labs that do food sensitivity tests. I've used quite a few different ones over the years, and I found one recently that I like the best because it tests a multitude of different factors, not just say IgG, but like IgG, IgA, IgM, and two other separate distinct pathways. So that's very, very comprehensive blood test where you can check 100, 150, 200 or more foods, and even chemicals and preservatives, things like that, molds. So that's one way to find out. And then another way is to do an elimination diet, which the elimination diet, but by typically what that means is you eliminate one or more foods and see how you do, and then you bring it back in and see if your symptoms clear up. But that is very difficult. I've done it, again, followed different ones over the years, but I came up with a better option, which I call the free diet, because it's free of not only gluten, but also the most common, it's free of the most common allergens and sensitivities: gluten, grains, yeast, soy, corn, legumes, eggs, sugar, GMOs. So 10 different main categories of foods. And again, we'll provide a link there for a complete copy of phase 1. So typically what happens, you follow the free diet for phase 1 is 4 weeks. So it takes about 3 weeks for your antibody levels to these particular foods to go down. So phase 1 is typically 4 weeks, and usually within that time, a lot of these health issues will start to clear up. And then when we get into phase 2, we start adding foods back one at a time to see if there is, to see what kind of reaction is, and then we can gauge. There's a certain way we add them back, once, so many days, one new food, so you can really pinpoint what it is. So that's a great way, an alternative to say lab testing, where you can identify what you're sensitive to. Just an example of that, I have a patient who's 25 who ate she actually had she was given some gluten-free cookies. She has a real strong sensitivity to gluten. It caused a lot of health issues for her, and she was doing great. And so she had these, what she thought were gluten-free gingerbread cookies for the holidays, and then come to find out they weren't. But so what happened is, after she started eating these, within an hour, she started getting a headache, nausea, indigestion. She's just wondering what was going on. So she then looked at the package, the ingredients, and she's like, "Oh my gosh, the first ingredient was wheat." So she just didn't realize that. Not only that, this lasted into the next day, and that leaded into other, more long-term digestive issues she had for a couple of weeks. Because like I said, your antibody levels it takes a few weeks for them to go down when you eat a food that you're sensitive to. So that'd be an example of delayed sensitivity. another example, like say, well, speaking of the holidays, so we just got through with Christmas, and so I had patients come in, just tell me different things. So one patient, she 29-year-old woman, and she gained 5 pounds over the holidays, not from eating a ton of food, but just eating foods that she was sensitive. She had already gone through phase 1 of the free diet, lost a bunch of weight, but with her, it was mainly sugar and gluten. Those are the 2 big ones. And she gained 5 pounds within, over the holidays. And then another patient who actually, 49 years old, and she lost 3 pounds over the holidays because she stuck with it. She was in phase 1 still, and she stuck with it because she was doing so well that she didn't want to screw it up. And actually, she's actually into it for 3 months now, and she has lost 28 pounds over 3 months. So she didn't want to get off track, which so it is possible to yes, even during the holidays, to stick with something if you're motivated enough and really encouraged by how great you're feeling compared to how you used to feel. I did have one extreme case where a patient told me about, again, she's very sensitive to gluten, yeast, and sugar, and she had a slice of a cookie cake, and by the next morning was 7 pounds heavier after one slice. Now, it's not the calories, it's not the amount of food, but when you eat a food you're sensitive to, it can cause inflammation, water retention, bloatedness, and you can really just get all swollen, just literally overnight. So on the plus side, you can also get phenomenal results if you identify what foods you're sensitive to and then eliminate those, like for instance with either testing or the free diet. You can really clear up a lot of health issues, whether it's energy, whether you're having fatigue or skin problems or brain fog, anxiety, lack of focus, again, digestive aches and pains, just a whole lot of issues that we mentioned earlier can be cleared up when you eliminate foods you're sensitive to. So if you have any questions or comments or have an experience you want to tell us about, feel free to comment below. And if you want a copy of phase 1 of the free diet, just click on the link below. And thanks for joining me today, and look forward to seeing you next week. Take care.